we're going to dive deeper into how, innovative finance solutions can be leveraged to address critical global health issues, particularly in this time of COVID-19, particularly as we look at issues of vaccine access when a vaccine is available, and access to other, critical needs in this time. And joining me on this panel are Guillaume Grosso, who's the Director of International Business Development and European Strategy at Gavi, the Vaccine Alliance, Thomas Opiyo, the Country Director for Kenya for Living Goods, and Dr. Nithya Ramanathan, who's the CEO and co-founder of Nexleaf Analytics. Thank you so much for joining me today. Guillaume, let me turn to you first. You've been helping lead Gavi's work on COVID financing through the COVAX facility. And I want you to tell us a little bit about some of the mechanisms, some of the innovative finance tools that you're using to help low-income countries secure vaccines. And Gavi has done this in the past. You've done advanced market commitments before. What have you learned from those experiences that you're bringing to bear now?
Thank you, Adva, and I hope you can hear me well. Hi, everyone. Indeed, you're right. Gavi was created in 2000 on the premises that you would need to go beyond classic finance to solve problems in global health. And so from the beginning, we put together some large innovative financial instruments at scale. And I think most of you have heard of the vaccine bonds, for instance. We call that IFIM. And what it does is that basically we use markets to issue bonds to get money upfront to buy vaccines. And then this is repaid against long-term donor commitments. One of the things we've been doing from the beginning is looking at innovative finance at scale. Really, how do you make a big impact with those tools? So for instance, the vaccine bonds, we've raised $6 billion since the beginning of the experience in 2006. So when COVID-19 hit us, and of course, the international community came to Gavi and other agencies to say, what are you going to do? You need to accelerate a vaccine. We need an answer that has to be available as soon as possible. Well, very naturally, we looked at our toolbox. What kind of innovative financial tools do we have? What can we use off the shelf, so to say, to address those new needs? We had created in 2009 a tool called the Advanced Market Commitment, which at the time was to accelerate a vaccine against pneumonia. And that worked pretty well in terms of getting it at a low price very quickly to developing countries and in large quantities. So we took that tool, we twisted it a little bit, we tweaked it, and we put it together to create what is now known as the COVAX AMC, which is the big international answer. And our goal is to use this instrument to bring 1 billion doses of a COVID-19 vaccine as soon as possible, and hopefully as soon as January next year.
And to that front, I think COVAX has just signed a new letter of intent today. I think you made the announcement for 200 million doses. So it sounds like you're well on your way towards that goal. Nithya, I wanted to turn to you. Your work focuses on supply chain strengthening and using data to do that. What are the key barriers that you're seeing today in the COVID-19 response, and particularly in terms of what's at stake for future vaccine delivery? What are some of the countries you're working with sort of most often asking for, most often struggling with?
Yeah, that's a great question. So if I take a step back, the COVID-19 vaccine presents a number of challenges to supply chain. So it is, in terms of the scale, the most unprecedented vaccine distribution challenge that countries have faced. For example, in Kenya, one of the countries where we're working, the Ministry of Health has talked about how the largest vaccine campaign they had undertaken to date was a measles campaign for children under 15. So now we're talking about trying to leverage the existing supply chain for routine immunization, which has been designed to serve children, and flip that around so that we can reach the most vulnerable healthcare workers, a completely different segment of the population.
Thanks. Thomas, I want to bring you in, and Nithya mentioned Kenya. That's where you're based. What are you seeing in terms of the financing gaps right now? I know you have a private sector background. How do you think the private sector can sort of be brought in as partners in this effort?
Thanks, Adva, and thanks to the audience. I think there are multiple levels of challenges, and I think the biggest gap really is around making the money available. Back to what Nithya was saying, if you look at the bare volumes, sheer volumes that are needed, and relatively quickly, so it doesn't need you a lot of time. You don't have a lot of time for forward planning, but compounded with systems where governments are inherently under-resourced, and also health is also deprioritized, so it brings that complex around it. So I think the bigger question is, how do we get to focus on that as a priority and coordinate it through government? Because also if you look at the levels of scale, and also looking at also the discussions of the previous presenters, all countries are a threat, so you cannot depend on somebody else, so that you can raise financing for this. In terms of private sector, I think it's going to call for a lot. I remember Richard talking about impact-associated financial mechanisms, P&Ls. I think maybe the sooner that was brought in, the better, so that all companies in different perspectives, not just in health sector, start looking at it in that approach. Then we see how much more they can invest towards a common cause like this, maybe for now. Yeah.
I'd love to jump in on that, actually. Do you mind, Adva?
Yeah.
Yeah, I really like what Thomas was bringing up, and it raises, I think, a few other really important things here. So if I take a step back, one of the challenges in financing for global health historically has been that it's been very top down and not a lot of flexibility for the realities on the ground. And exactly as Thomas is bringing up, country governments and countries' ministries of health are really at the center here of the storm. And one of the things that we're starting to see, for example, in the context of Gavi health system strengthening funds, is that there's more flexibility. And we're hearing that from ministries of health, that the way that the financing is structured is very intentionally designed now in the context of COVID to give countries the flexibility that they need to respond. The second point I wanted to raise here is around private sector engagement. So what doesn't get discussed, I believe, enough is the real challenges that ministries of health face in engaging the private sector. So it's not just about getting the flexibility of financing, but also there are very real concerns that ministries have in terms of transparency of pricing, as well as accountability. One of the early lessons we learn in business is don't expect responsibility for something that you don't have control over. And so as we transition to this new model where ministries do have more control, we also want to look at how can we kind of flip that relationship between ministries of health and the private sector so that ministries of health have more visibility, have more ability to manage the performance of the private sector and really demand what they need.
Great. Guillaume, I want to bring you back in and picking up on what Nithya was saying. I mean, governments obviously have a really critical role to play in this, not only in their coordination capacities, but they also need to dedicate more resources to these issues. I think we've seen governments, particularly across the African continent, despite sort of commitments to dedicate certain, thresholds of funding to health, that those have often not been met. Gavi works very closely with governments, and you often, are trying to help these governments find a way to transition off of Gavi support eventually, and sort of to build up some of those institutions and structures within government. So tell us a little bit about what you're seeing in those efforts, how governments can sort of be encouraged and incentivized to really invest in global health, and where they might be better educated about how they could leverage their capacity to bring in other financing and what sort of tools they might use.
This is so true. And actually, that's one of the lessons actually from our experience practicing innovative finance is that, the immediate thing you would think about when you say innovative finance is obviously finance, right? It's getting this money, additional money into the programs, and how do you leverage maybe non-traditional funding sources. But we found that it's got many more virtues than just the money. And one of those virtues is sustainability. So it's exactly what you're saying, is how do you construct an instrument that will at the same time leverage additional funding, but also propose this kind of long-term vision where you can bring the industry in the long term. In the case of a COVAX AMC, for instance, what we're trying to do now is making sure that the industry will make the upfront investment and will be there in the long term to provide the vaccines. And while we're doing that, how do you at the same time ensure that countries themselves take a share into that, and that share will grow until eventually there will be full sustainability. Now, we've seen that in the past with Gavi, and you're right to mention it. We have this transition policy, which means that countries, as the GDP increases, their share of the funding will increase. We don't call it innovative finance because we call it just finance. We think it's how it should be. And at the end of a certain transition period, when the country is able, then they get rid of us essentially, and that's a very good thing. Now, that's how we build the innovative financial instruments that we bring. But I want to add one thing, which is also actually something that Nithya, you were mentioning earlier, which is that beyond all those aspects, there's also the aspect of skill transfer. Now, that I think is fundamental, because if you're sitting in a government chair, very often you have a lot of people that come to your door and say, we have fantastic solutions, and you might be a little bit overwhelmed to do the selection. You know what you need, but you're not sure how reliable the person you're talking to is and whether you should trust them or not. And one of the things we've been doing with innovative finance, with an instrument, for instance, like Infuse that Gavi has, is to connect an ecosystem of very powerful innovative solutions and a set of needs that are brought together by typically ministers of health in countries who know best what is needed. And by doing this connection, what you do is, of course, you bring the finance, but you bring the skills, you bring the solutions, and you set the path for those solutions very often to turn into, in the long run, commercial solutions that will be self-sustainable and that will be completely embedded into the government systems. So I think that's also a very important use of innovative finance.
Thanks. Thomas, did you want to?
Yeah. I wanted to jump in. I mean, into what Guillaume is saying. I think because what you're saying is very critical. You know, even as you're talking about just, resource mobilization on one aspect, I think part of the real problem here is there's a lot of inefficiency and losses in between the system. So if how do you leverage on all those, both the what I call the problem side and the solution side, to integrate the two, to also improve efficiency so that you can actually, because if you talk about impact, really you can reach the highest numbers. I mean, just giving immunization as an example, you get the tons of antigens expiring somewhere else, and there are children who are going unimmunized at the other side. So how do you link that? And probably this is a play where things like technology, usage of data, for the real-time decision making comes in. But yeah, my additional comment to that really is also looking at approaches like the match funding that I'm sure Gavi is really known for. How can we work with government really to try and propagate that at the onset now for something like COVAX into the future? Yeah.
Great. Nithya, back to you just on this point on data and sort of what you think is needed there. And maybe that's what you were just about to jump in on, but I do think that can play sort of a critical piece in this. And also, as you're trying to make a business or investment case for health, that data is a critical tool.
Yeah, that's a great point. I was actually going to jump in on a different point, so I'll briefly touch on that and then come to your question around data and how it can actually close the loop here. So one of the things that's so important about what Thomas and Guillaume are both talking about is speaking to this dysfunctionality in traditional global health, where the payer has not traditionally been the actual customer. And so that's where exactly what Guillaume is talking about and Thomas in terms of this match fund that Gavi's launched and Infuse. What's been really powerful is that organizations like Nexleaf have been able to actually work directly with ministries and interface directly with ministries as the customer and behind the scenes, the payer, in order to build out not only that technology and skills transfer that Guillaume was referencing, but actually create more sustainable systems for the ministry to actually build the business case and actually procure these solutions. It creates a much less distorted market. So to your point about data, obviously I'm really passionate about that. That is, what we live and breathe every day. One of the things that we've been seeing is that real-time data, as Thomas was referencing, has been potentially a game changer here. And here's why. So we build sensor technologies at every level of a health system. And what we've seen is that in terms of aligning incentives, data has been critical. When everybody's looking at the same blueprint, when everybody's looking at the same game plan, we can all kind of come together and agree on the path forward. And that's what data has made possible. The second thing that is potentially making possible is this new conversation that we really want to start seeing between ministries of finance and ministries of health. If we really want to get serious about having countries invest in their global health systems, then that channel of communication between ministries of health and ministries of finance is critical. And data is going to really underpin that business case that ministries of health now have to make for what is the value, what is the return on investment, and making that business case for the spend in global health.
If I can come in, if you allow me, Adva, I just
Yes,
wanted to come back
please.
because I think what you just said, Nithya, is spot on. And to Thomas' point, one of the big, incredible power of some of these innovative financial instruments is de-risking. It's de-risking for everyone. It's de-risking for governments who need to navigate the jungle that I was mentioning about earlier. It's de-risking for the companies themselves, for the entrepreneurs, particularly for the startups, because it can be pretty hard to understand the jungle from that side as well. And what you do with an instrument like the matching fund, for instance, is you bring funding that will be taking risk. And because that funding is taking the risk, that means others don't have to take it. And you test solutions and then you scale them. Now, it's an incredibly powerful model because it allows you to scale fast or fail fast. If it fails, you just get rid of it and you move to something else. If it works, then the power of innovative finance, like the matching fund, is that you can then roll it out country after country after country. And I think this is exactly what, Nithya, you've been doing, and Thomas, what has happened with yourself and with Living Goods and Last Mile Health. And we have now plans that will allow us, because it works, to go to scale and make a difference that matters in so many different settings. And that's only because we have those tools that take the risk and that de-risk the approach for governments and for the companies.
Great. Thomas, I wanted to go to you quickly because Living Goods is really known for your ability to reach the last mile. And so as we're talking about financing solutions, what do we need to be keeping in mind so that these solutions, aren't just to finance supply for folks in urban areas, for folks who are wealthier in a country? So I'm curious how you can share your insights and really sort of push people who are working in this field to ensure that that last mile is reached.
Thanks, Adva. I think, you raise a critical point. I think, how do we, and really, so when you look at even the need for vaccination, you generally find that there's an element where, based on the socioeconomics, the underprivileged are the ones who tend to be more, they're more vulnerable. So they actually have less right from the onset, rules of nature. So how do you start by targeting? And I think the element here is really around how do you drive equity, but how do you target the most vulnerable? Because remember, even when you go into something like vaccines or any other service or product, once you can ensure that the most vulnerable is taken care of, the other people will take care of themselves in the food chain. So I'm sure when you start from that prioritization approach, then that's the place you need to target most, by and large. But then back to the broader health system, and when I look at it, and maybe more a bit of context of places like Kenya, you then need to be very conscious about the differences across the different ecosystems, and also co-create solutions with them, because also just tying it back to what Guillaume was saying about sustainability, so that people also own the problem with you, but also as much as possible, how can you bring them in right from the onset, the authority and systems in those ones, so that you can walk with them through that journey. Because I think, then you get it more in a sustainable approach, because it's going to take a bit of a longer time to reach where you want to be. So those are key pieces that I think would be very critical. Thank you.
Great. We had a question come in, and the person says that it asks the question, can you link performance outcomes to funding for better health? And they say, that they think that's sort of the key to innovation in this space. Is there anyone who wants to jump in on that? Nithya, you want to?
Yeah, I'd love to. Oh, Sorry, go ahead, Thomas.
No, go ahead. I'll jump in after you. Sorry.
Okay. A couple of things about this. One, so I'm a big fan of performance-based outcomes. Results-based financing is another term used. If we do that too prematurely, we run the risk of creating negative incentives. In other words, that people, whether it's ministries of health, private sector, whoever the stakeholder is, not being honest about what's working and what's not working. And so objective data is critical as part of performance-based pay or performance-based outcomes. But really at the stage we're at, I would actually say that we need to be more incentivizing objective information sharing. I think Gavi, and this comes straight from Seth all the way through the organization, has been really critical in talking about how they don't want 80-page reports. They don't want BS. What we need right now as a sector, but what we need right now in this sector, if we're going to advance and introduce innovations, is actually authentic, objective data on what's working and what's not working. But absolutely, one of the things that we're working towards actually is a performance-based framework for countries to engage the private sector. So you put a sensor into a truck, a private sector entity says, I promise to keep this COVID vaccine cold from point A to point B. You've got a sensor. Now suddenly the government has objective data that says, okay, you've kept it at the correct range. We're going to give you this specific pay. You can start to quantify the value and the return on investment. So performance-based outcomes is critical. But if we start there, we run the risk of not learning exactly what's working and getting to that next phase of scale.
Go ahead, Tom.
Good. Thank you. My only addition to that, I fully aligned with you. Actually, the only addition to it would be, how do you try, and even at the formative stages, institutionalize that at the last mile? I know you talked about the last mile of community. So if you look at maybe the health ecosystem and back to what maybe Living Goods does, is really supporting performance management at the very elementary level down there. So if you want to talk about, let's say, vaccination, how do you drive that even the community health workers who will be reaching those houses, whether it's something like coverage or number of defaulters, trace and track, that the whole performance management process is institutionalized at the very basic level, then you can drive it up the whole ecosystem. Because I think part of the failures and challenges with some of this performance-based financing is, people want to look at it at a systems level, but then it may not have been operationalized effectively at the very, what I call, where the work actually does, it happens. So, yeah.
Great. We've only got a few minutes left here, about 3 minutes, but I wanted to end with a question. And we've talked, and actually you've sort of teed this up, Thomas, because you've talked not just about COVID-19, but global health more broadly. And so I wonder what lessons this crisis can sort of teach us about, how we look at innovative financing in global health more broadly. Or if there's sort of an issue or a place where things need to be done differently in the global health innovative finance space, new mechanisms that are maybe needed down the road that this has brought to light. So I'll go to each of you for a sort of quick, less than 1 minute response. Guillaume, let's start with you.
Thank you. And I think, for me, there's a couple of very important points there. The first one is that the future is about scaling what works. So before inventing new instruments, we now have enough, experience with stuff that really works and works at scale. And we saw that with COVAX. What do we have on the shelf? How can we adapt it? And how do we make it work? So I think there's going to be a lot more of that. The second is that the future is about blending. And I think that's coming very strongly, for instance, with our COVAX work, where we have the AMC, the Advanced Market Commitment, which was recycled from our pneumonia work, and we're plugging this into our vaccine bonds. So we can use the vaccine bonds to use some of the money that we put into the AMC. So that sort of blended instrument, I think, has a very strong potential. The third one, I think, is that's going to be as much about finance as it is about the skills. And so we cannot underplay that, because especially in the times of COVID, what we will need, for instance, in the vaccines field is how to face the anti-vaccine movement, how to face the resistance to vaccine. When we get that vaccine, the worst that could happen is that we have millions of doses that could save millions of lives and that nobody takes them because of wrong or fake information. So we will need the skills, we will need the talent, we will need the data to the point that was made earlier, to be able to make that case. And the final point I would say, which goes beyond health, is that whatever we've learned and that works, it is time to pass it on to other sectors than health. And I think, it's very powerful now that when I see the Education Commission taking our IFIM, our vaccine bonds, and saying, we're going to do IFED, the facility for education, modeled largely after IFIM. That means that we can breed success, not only for health, which is extremely important, but also for other sectors. And that's the way we will achieve the SDGs, because we just have 10 years. So we'd better hurry up.
Great. We're basically at time. So Nithya and Thomas, if you each have just one quick thing you want to add in about 20 seconds, I'll go to you first, Nithya.
Yeah, I think really quickly, de-risking. Guillaume's point was excellent. And what we're seeing, for example, in Tanzania is that because the initial de-risking came in completely supporting the initial uptake, then the ministry is able to make that effective case and then actually pay and procure and sustain these solutions. So in terms of long-term change for a health system, I think that initial de-risking coupled with Ministry of Health sustainability afterwards is critical.
Great. Thomas?
Thank you. Last for me is basically, incentivize to have government at the table from the onset. Thank you.
Great. Well, thank you all so much for this wonderful conversation, and look forward to hearing more about the work as COVAX and all of your individual sort of work on this front moves forward.